Can you hear me? Okay. So we're going to hack the system here a little bit because we're impatient and we don't want to waste everybody's time. So what we're going to do is we're just going to share some of these mics, and it might be a little awkward, but bear with us. So anyway, what I thought we'd do is we'd just get started by asking a couple questions to different people, and then it's going to be a kind of a conversation from there. So first off, holy crap, that was some fascinating stuff. I mean, round of applause to these guys. It was amazing. So I want to start with you down there, Jose. Just a question about some of the stuff you're doing. It's a lot of the kind of, kind of local development of new ideas as well, which is some of the stuff that I was talking about. So it's kind of close to my heart. What do you guys do, or do you do anything to do a reverse distribution of knowledge? So one of the things I've seen is like there's a lot of stuff coming out of MIT and Stanford's D School where people go to these countries. Mm-hmm. Do you ever have people from those countries who are contextually aware learn about your programs either at MIT, or do you take all the knowledge to them and they learn it there and kind of come up with new solutions?
We're all about dominance for design at MIT, so we just push. No, I'm kidding. Of course not. No. I think thanks. Yeah. So a lot of it is just impeded, frankly, by the logistics of sometimes bringing somebody from the developing world into the United States, visa issues and that sort of thing. That's become difficult sometimes. What we're trying to do more of is that horizontal transfer of knowledge, where somebody from Addis will go to our clinic in our partner's clinic in Nairobi and share that, and then somehow share that knowledge with our Nicaraguan partners. We find that a little bit more exciting. And of course, we do have mechanisms for people to trickle the solutions up. And sometimes the solutions that are in fact designed in the field then become part of products that then we now pitch to American healthcare.
Awesome. So I'm a big fan of that. Is this on again?
You want to pass this one?
Wait, I think I'm on now. Okay, so I'm a big fan of that kind of south-to-south sharing of knowledge. I think it's a huge, because you have people from, similar circumstances but in different countries. I think that's fantastic.
Yeah.
So the one person that hasn't been introduced up here, I just remembered, is Josh. But a lot of you know Josh from last year. But Josh, maybe you could just kind of chime in too on some of the background you have in the same space, because I know you've been doing some of your own innovative stuff with hardware.
Yeah. It's great to be here. Such impressive work. I'm thrilled to join the panel. I want to dive right into a challenge, which I also see as the biggest opportunity in this space right now. I talk to a lot of engineers, and what Medic Mobile does is we support mostly community health workers, but also family caregivers and patients. Lots of times using communications technologies, simple things like SMS and SIM card applications, but also more complex technologies. And I spend a lot of my time talking to engineers. We work in 18 countries, mostly sub-Saharan Africa, South Asia, parts of Latin America. And I talk to engineers, and the conversation starts with them explaining their solution to me. And I think we're at a space that we need to just be very, very clear and honest that the things are technology tools that earn their title as solutions when they're used by someone somewhere to achieve a better outcome. And it's a solution. Cheers. No, and it's a solution to that person at that time, and that's when you earn the title of solution. It's great for marketing pitches, but in reality, I think we need to really shift there. But then we start to talk about systems thinking, but you also there's so much that unravels in a beautiful way from that. And I'll give one really quick example. I met a woman who was developing a $2 temperature monitor that plugs into the headphone jack of a cell phone. And she was monitoring remote islands and the temperatures there. And I said, we should put this in vaccine boxes. And so Gates Foundation gave a little bit of funding to trial it in Kenya. And the data was there. We saved 4 fridges of 1,000 vials each with text message alerts coming from these boxes. But there was also the qualitatives, the story. So there were health workers who could sleep at night because they knew the vaccines were safe if they weren't getting text message alerts. So there's so much more than the technology solution. It affects systems, sometimes in really dramatic ways.
Thanks, Josh. I want to kind of switch gears here a little bit. I want to talk about maybe what's the most exciting thing about, poop right now?
Poop is very exciting. Well, so we see it's been 2 years now that the Gates Foundation is really focusing on sanitation and really the bottom line of sanitation, if I may say. So we are different universities trying different technologies in order to have add possibilities to the types of sanitation that are available throughout the world. So it's tremendous to see that there is a lot of people coming together and thinking about new ways of dealing with human waste, not only digging a pit and pooping in it. So that's the new thing. And actually, for people who didn't work in sanitation before, like myself, it's really interesting to see that there is a big lack of engineering in this field. We tend to see it as the yuck thing, but actually it's kind of fun.
Thanks. So, what you do with printing organs seems like a miracle to a lot of other people, I'm sure, if you're like me. There's got to be some major challenges in that space. You alluded to some of the regulatory ones and everything. What are the challenges that are kind of standing in front of you from taking what you've done in the last 10, 15 years and putting it towards the next 5?
Yeah, so the main thing has been the solid organs. That's really the most challenging. So the complexity goes from flat structures such as skin to tubular structures such as blood vessels to hollow non-tubular such as stomach or bladder. And finally, the most complex are the solid organs. And the solid organs are the most complex because they have so many cells per centimeter. So the nutrition to those cells becomes very important with the vascularity or the blood vessel supply. So as I mentioned, we've been able to put the first 3 types in patients, but not yet the 4th, which are the solid organs. So basically, we're really working on that and also working on making sure we can make these technologies much less expensive. That's the printing technology, where you can really make this available to everybody.
Could this ever happen in a place like Kenya? Could you print an organ there at some time in the future?
Absolutely. I showed you the desktop inkjet printer that we just modified. So in reality, for most tissues, the first 3 types, you can actually use just those printers alone. So the technologies, and that's really why the bioprinting, we got into it over a decade ago, mainly to scale it up, make the technology cheaper, and just use your common household tools that you have to make these technologies available to everyone.
And just one more quick question. You showed that one kid who had a bladder created for him. What's the number of people per year having organs printed for them right now?
Well, not many, because a lot of these technologies are really basically done under regulatory guidelines, which I mentioned that was one of the challenges, that you really have to go through many, many steps to actually get these technologies to the population at large. So these technologies right now in the area of regenerative medicine, where you're creating these organs one by hand, are being implanted in small clinical trials and in larger clinical trials. The average time for a drug, just the common medicine you take at home, the average time for that drug to have been approved before it reaches your home is about 15 years from the FDA. That's from the time it first reaches the first patient to the time that it actually can be released to the general public. So that's like your Lipitor or anything you may take at home. And so for these technologies, it's actually about the same. We expect the timeline to be about the same.
So, Jose, question for you. How many of the products that you're building are health related, and how much do you have things that aren't health related as well that you're working on, or that your lab is?
No.
It's all health. Okay. And
So it's not really all health related.
And of the devices that you've done and the kind of solutions you've come up with, which one's the most exciting or the most out there one that you think could make a big hit out in the real world?
So we have, I think, we're working on 2 new things right now, which is a lot of this, the crowdsourced diagnostics. And what we want to do is take the diagnostic out of the clinic and into the everywhere domain. And so one of the things that we've gotten a lot inspired about is, a lot of these new quantified health devices. I got this Fitbit. I went to a conference and they gave it to us for free. But we can track how many steps we take and that sort of thing. But we have no idea what our body does after a jog, or after an all-nighter, or after a surgeon's been operating for 6 hours. And we have really no way of knowing that. And one of the things that we want to do is, how do we bring these devices down to the level of something that I could buy at a Radio Shack or at a GNC, but at the biology level? And then, as I mentioned earlier, how do we aggregate to compare what's happening in Chapel Hill versus Raleigh versus Winston-Salem?
So I guess this is a question for any of you. We see devices like, the Up, Fitbit, things like that are kind of just they're consumer level devices that are really taking an in run on some healthcare things, right? In your field, are there any other consumer type things that? Well, I know for Josh, you use the consumer type things to do an in run on health solutions. Is there anything that could come up in the sanitation space, or in the that's just made by another company trying to do something different that could make an in run on some of the sanitation issues or some of the organ printing, or is that going to be done in some kind of other part of the world which just they don't have the same regulations?
Well, in our case, our group at Caltech deals with the treatment, but other groups funded by the Gates Foundation also deal on the interface with the user. I saw many different systems that people are trying to implement, and they are talking with the local communities and see what's the best way, for example, for people to squat, what do they do, what's the movement. Other ways, what people are also looking for, what kind of interface, and where do they have the clean hand and the dirty hand, and that kind of stuff. So there is a lot going on around that. And on the technology side, it's a little bit different because it depends where you're going to be and what's your approach on the technology. If you want to go from what's available in the place and then build something new, or if you, at the contrary, look at making a totally new technology and then find ways to bring it to the space.
Yeah, and so on the organ printing side, I guess my question is, with all the steps you've made, but there's regulatory blockage here, could this just be done in Costa Rica instead?
Yes, absolutely. The regulatory pathways differ in different countries. So actually, you can start. So in fact, many of our trials we do abroad first, and then you can use that data from abroad to actually facilitate your regulatory pathway here. So we have actually a network of 10 centers internationally in pretty much every continent, so that we can, when we develop these technologies, we can have these technologies in all over internationally, and at the same time we can gather the data internationally and use that to back us up for the more complex regulatory nations, such as European nations and the U.S.
Josh, when you're dealing with your healthcare solutions, your guys are way down there on the ground. Like, what do you think what's the reaction to technology that's kind of put in front of them?
Yeah, I think that our distributed team and our regional teams and our partners like IntraHealth, and likely a lot of people in the room, they want technologists who are really excited about delivery, and excited about terms like equity and coverage rates and coverage percentage. So it's a very clear fight right now. We doubled life expectancy on the planet in about 100 years, but we left 10 countries behind. 10, 15 countries behind. There's still 10 countries where 1 in 4 kids don't make it to age 5. And we know exactly if we could harness technology, and it's why we focus on the technology that's most ubiquitous, and that's the GSM coverage. And people talk down to SMS all the time, but it works where it needs to, where we're aiming for those 99% coverage rates for the things that we know save lives. And I really hope that organ printing is something that that we try to get a 99% coverage rate for people who need those services in 10 years when it's there and ready. But we have the vaccines, we have the antenatal care services, we have some things to tackle now, and then we'll have delivery systems upon which we can pipe these new things in 5-10 years. So we get excited about delivery systems.
What are the challenges that you're facing with even the, like, I have a little bit of background on the SMS side as well. So what are the biggest challenges you have when you're trying to deploy some of this stuff into Malawi or, rural Uganda?
Yeah, the most important challenge, or the biggest challenge, is knowing what's actionable and to whom and when. If you can figure that out, you can figure out how the data transfer mechanisms. It's as creative as you can imagine. I mean, a SIM card that will store 6 messages worth of data when you are around the side of the mountain, and when you come to the side where you have 1 bar of signal, it sends it as an encrypted text message. I mean, you get as creative as you need to, and that gets you coverage to about 95% of the people on the planet. Those types of hacks and solutions. Technical solutions.
So I think it's fascinating trying to solve problems with old technology. In the U.S. or Europe, you have a tendency to see people move to the new technology really quickly, right? So as soon as a new smartphone comes out, people bump up to it, and then the technology behind that, all the developers and all the software programmers also shift. But in Africa, we have, what I like to say is, like, if you threw a dart in a room of technologists in the Bay Area, you couldn't hit a single one that could code for USSD or SMS. But if you do it in the iHub, you can hit, about 25% at least of those people can do that, right? And which is really interesting. So, there's many people who are the talking heads of the technology space, and they'll kind of talk down to SMS or USSD. Meanwhile, in Africa, we just ignore it and abuse the hell out of it, and be creative with it. And so I love to hear solutions like Josh's, which is he really just hacks the back end for SMS and SIM cards, and comes up with great solutions that are really mundane at the same time as they work, right? So there's the cool stuff that doesn't work, and then there's the mundane stuff that works, but it's also really interesting if you know what he's doing. So I'm really a big fan. So just kind of a last question, and I'm kind of open up to everybody. The challenges in your space, we talked about some of them, but that's the stuff that's cannot be that exciting. I want to know where do you want to be in 2 years with this stuff? Like, what's going to be the big thing? With toilets, is it going to be that we actually have some type of solution that is in also in rural Malawi? With the hearts or the organ printing, are we going to have that actually happening more in a couple of years? Which of your devices is going to hit it big? I know one of them is.
Sure. So basically, for us, the challenge that we face is really a challenge that everyone is facing, which is when we are developing these technologies. Just because we're doing a clinical trial in another country doesn't mean we don't have to go through the regulatory path there too. You have to go through all the regulatory paths there as well. And anytime you want a technology entry, you have to go through every country to get that technology approved. So it's actually, I think we have to start thinking about how can we start globalizing the regulatory process for medical technologies. So it's not just about having technologies available, and it's not just improving those technologies we currently have and how do we deliver them, but it's also how can we globalize the regulatory process so that there's one regulatory process that allows the technology to go everywhere at once.
So in our case, for sanitation, it's a little bit less regulatory than medical devices. So we are done with the technology is pretty much proven. Now we are working on reducing the size and adapting it for different countries. So that's going to be what's going to happen in the next 2 years. We're going to start having one prototype in India, and then adding others all over Southeast Asia, and then targeting Africa. So we move forward little by little with local partnerships.
I need to comment again on the regulatory side because I couldn't agree more. I mean, there's a huge lag. Despite what we can pull off in 2 years inside the lab, the regulatory is still a burden. In addition to the fact that then people wait for health outcomes, and then they adopt. So you could have something on the shelf that you can buy at More Medical, but nobody will buy it from the procurement, from a health until there's been several studies that show. And we understand why they do that, but I think that in 2 years, what I hope is that the community will have a little bit more appetite for risk. I love this quote by Neil Stephenson, the scientific author, who said, innovation cannot happen without accepting that there's a huge risk and that you might fail. And I'm paraphrasing on it. He said it much better than I can. But the reality is that's what it takes to go to the moon and all these other places. We're going to blow up a lot of things in terms of inside the lab. And if your lab is not doing that, then we feel that means that you're not reaching for the right thing. So in 2 years, I think we're going to have a lot of things that are going to just fail. But hopefully we'll get some surprises from our local innovators. I think that's where, and I also think that we're going to get surprised by these consumer devices. People are just going to skip it, the regulatory stuff entirely.
Yeah, so very quickly, and I think just in 4 words, 2 years is a very short amount of time, for the record. I think in 4 words, it will be tools that build tools. It includes hardware and basically a radically distributed components, including things that Jose is working on, things like Raspberry Pi. And so on the hardware side, radical distribution, but the same thing with software, tools that enable you to build your own tools. And we're counting on the web being the platform for that. So we're building just really radically distributed web applications. But then I think as exciting as hardware and software, it's that it enables tinkering with the use cases. It enables tinkering with the behavior change strategies and the messaging frequencies, so that it's the local health workers that are doing the experiments. And that's where 2 years, it's ambitious, but I hope that's where we'll be.
So if you'll join me in giving a hand to everybody here. Everybody here will be around for the next 2 days, so I think there'll be plenty of time to talk to them about their area of expertise. Thanks a lot, guys.